It's 7:38, new on Daybreak. October is Breast Cancer Awareness Month. The National Breast Cancer Foundation reports that 1 in 8 women will develop breast cancer in her lifetime. I'm joined this morning by Dr. Tara Ballinger. She is from IU Health, and you're here to talk about some of the warning signs and symptoms that people may notice, because finding this disease and testing for it, it's not a one-size-fits-all.
Right. So I think certainly the way breast cancer presents, or the way we should screen for it, is really different in every woman. And it's so common, and there are so many different ways it can present. So some of the things to look out for are skin changes, pain, changes in the nipple, lumps or bumps. Really anything that's kind of out of the ordinary you should bring up to your doctor.
And this is something that you can kind of do maintenance on your own at home regularly. You don't have to wait until you go to the doctor every year or every couple years that you go to check this out.
Yeah, I mean, I think it's just so important for women and men to be familiar with how their breast tissue looks and feels, so you can be aware of any changes and to not be worried at all, to bring them up to your doctor and really advocate for yourself.
So what would be some changes that you should bring up to your doctor, or something that you feel or see that you should say, hey, this is unusual?
Yeah, so any kind of difference in lumpiness, a lot of times cancer is harder, kind of like your knuckle as opposed to the skin on your palm. Skin changes, redness, sometimes dimpling, kind of like the peel of an orange or something like that. Really anything out of the abnormal.
So what would be maybe some symptoms, or are there any internally or outside of things you could actually see that you may notice for invasive breast cancer?
Really any changes at all. It's really different in every person. Sometimes a nipple will invert a little bit. There can be pain or discomfort under the armpit. It's really any changes at all. It's really different in every person.
And this isn't something that you can only get if you're an older woman or anything like that. It's something that pretty much all women should probably be conscious of, right?
Right. I mean, you can get it at any age, young, old, male, female, whether you have a family history or not. And it's just really important to know your own personal risk factors for breast cancer and talk to your doctor about those.
And you know, I know that for families that have someone that they've either lost or have seen battle cancer, they're very vigilant about these issues. But for people who have never experienced it, I think it's easy to write it off as, oh, that won't happen to me. Oh, I'm only 20-something years old.
Yep.
I'm only 30-something years old. But that's not the mindset we need to be in.
Exactly. Actually, most cases of breast cancer present in women who don't have a family history. It's just such a common disease that it's important to be vigilant for it, no matter who you are or what your history is.
And obviously, the easier you catch any kind of cancer, the better off you're going to be.
Exactly. That's why breast cancer screening saves lives, because a cancer we detect by screening on mammogram presents earlier and is much more likely to lead to life-saving cures than something that we find just by feeling.
And how often should you get a mammogram, and at what age should you start getting those regularly?
Yeah, so that, again, there's really no one-size-fits-all. It's really different for every woman. So I usually recommend that you begin talking to your doctor by age 40 about having mammograms, and even earlier if you have any family history.
Awesome. Well, thank you so much for joining us today. We appreciate your time and all the education you've given us. So make sure you take those tips, use them, of course, for yourself, pass it on to family members as well. But